Hello everyone and welcome back to my channel. I am Dr. Shyam Banerjee, ENT consultant, and today we are diving into one of the most exciting frontiers in modern otorhinolaryngology, and that is regenerative medicine. Specifically, we will be exploring the fascinating role of platelet rich plasma or PRP in ENT care, from healing chronic conditions to enhancing surgical outcomes. What makes PRP such a powerful tool? How does it work? And where is it being used right now in our field? That's exactly what we will cover in this presentation. So, whether you are a fellow clinician, a student, or simply curious about cutting-edge treatments, stay tuned as we uncover the power of PRP in ENT. So without any further delay, let's jump in. Let's start with the basics. What exactly is PRP? PRP, that is platelet rich plasma, is an autologous substance, which means it's derived from the patient's own blood. Over time, it has shown a remarkable potential across various surgical applications, including those in ENT. So, at the heart of PRP's healing power is its rich concentration of platelets, which are not just involved in clotting but also carry a powerful mix of growth factors that stimulate tissue repair and regeneration. Here is a quick look at PRP's healing spectrum. Firstly, insulin-like growth factor or IGF for tissue growth and repair. Transforming growth factor, that is TGF, known for modulating inflammation and promoting healing. PDGF, that is platelet-derived growth factor, crucial for blood vessel formation and tissue remodeling. Epithelial growth factor or EGF, which aids in epithelial regeneration. Fibroblast growth factor, that is FGF, important for connective tissue repair. And finally, VEGF, that is vascular endothelial growth factor, which boosts new blood vessel formation, enhancing tissue oxygenation and healing. Together, these components turn PRP into a biological powerhouse, making it a valuable tool in regenerative medicine within ENT. Now that we have understood what PRP is and why it's valuable, let's briefly walk through the key steps involved in preparing PRP as seen in this video clip. Firstly, venous blood is drawn from the antecubital vein and it is then put in an acid citrate dextrose tube or some glass container and is weighed. Following which, the same amount of clear saline is taken in another vial and both the tubes are subjected to soft spin in the centrifuge for separation. After separating, the plasma of the supernatant is transferred to another tube without any anticoagulant, and this extracted supernatant is then subjected to hard spin for concentration. The upper 2/3 is platelet poor plasma and lower 1/3 is platelet rich plasma. Now the platelet pellet settles down at the bottom and this is shaken with an 2.5 ml of plasma and is extracted in an insulin syringe. This PRP can then be carefully extracted and prepared for injection into the target site, whether it's the nasal mucosa, vocal folds, tympanic membrane, or post-operative surgical bed. Each of these steps ensures the purity and potency of the PRP, maximizing its regenerative potential. Let's now take a look at one of the most clinical impactful applications of PRP, its role in post-surgical wound healing. Here we see a visual timeline of wound healing after PRP application. Notice the clear progressive reduction in wound size and improvement in tissue granulation over just a few days. This is due to PRP's potent concentration of growth factors which accelerate angiogenesis, epithelialization and tissue regeneration. On the right side, the bar graph compares mean scur diameter between the PRP group and a non-PRP group over time. On day 4, the PRP group shows a noticeable advantage with smaller wound diameter. By day 8, the difference becomes even more prominent. Healing is clearly faster in the PRP group, and by day 10, both the groups reach similar scar sizes, but the PRP group got there much faster, minimizing discomfort and infection risk. This not only demonstrates faster healing but also highlights PRP's ability to improve post-operative outcomes and especially valuable age in ENT procedures, where wound healing can influence voice, breathing, and appearance. Now, to understand how PRP accelerates healing at the tissue level, we turn to histopathological comparisons between control group, that is untreated group, and PRP treated ulcers. On the left, the control ulcer shows minimal epithelial growth, poor vascularity, and a lack of organized healing structures. In contrast, the PRP treated ulcer on the right reveals a well-formed epithelium, active collagen deposition, and a dense vascular network, all crucial components of effective wound healing. The data table further supports these findings. In the PRP group, we observe complete epithelialization, collagen deposition, new angiogenesis, and expected inflammatory infiltrate, all hallmarks of robust tissue repair. But in the control group, while inflammation is present, but epithelialization, collagen matrix formation, and new vessel growth all are absent. This histological evidence further confirms that PRP doesn't promote surface healing only. It rebuilds the tissue from the inside out, reinforcing its role as a powerful adjunct in post-surgical wound care. Platelet rich plasma is now finding its place in the medullary surgery, particularly in Tympanoplasty, where it significantly improves graft uptake and hearing outcomes. Correct? First, the graft material, whether it's temporalis fascia, perichondrium, or cartilage, is soaked in PRP. This step enhances vascularization, boosts cell proliferation, and improves graft adherence. Next, during medullary cavity preparation, PRP is applied directly to the mucosa and any tympanic membrane remnants, creating a biological scaffold that promotes tissue regeneration. In the graft fixation step also, whether onlay or underlay, PRP is layered over and around the graft, and this improves adhesion and reduces the chances of graft displacement. Finally, PRP soaked gel foam can also be placed into the medullary and external artery canal, where it helps stabilizing the graft and further promotes healing. A study by Taneja in 2020 showed that PRP significantly increased the graft uptake rate to 95% compared to 85% in the control group. Even more impressively, hearing improvement was observed in 78% of PRP patients, far superior to the 46% seen without PRP. Here in this video, you can now see something called as platelet rich fibrin precipitate, or PRF, which can also be used as a graft material for tympanoplasty. And here is an intra-op image showing application of PRP soaked gel foam in the medullary cavity. This innovative use of PRP enhances both structural success and functional recovery, making it a valuable tool in modern tympanoplasty. Platelet-rich plasma is also being explored as a treatment option for sudden sensorineural hearing loss. Though still theoretical, PRP's growth factors may support inner ear repair by reducing inflammation, protecting surviving hair cells, and improving local blood supply, even though full hair cell regeneration may not yet be possible. Meta-analysis comparing PRP to steroids have shown consistently better hearing outcomes with PRP. In 2023, a study by 𝐃𝐢𝐬𝐜 et al. PRP improved hearing by 25 decibel compared to 18 decibel with steroids. As per 𝐃𝐢𝐬𝐜's 2024 data, a 30 decibel improvement with PRP was shown, while steroids achieved only 22 decibel. Similarly, Tom et al. In 2022 reported 28 decibel improvement with PRP versus 20 decibel with steroids. This video shows the intratympanic administration of PRP, delivering it directly into the middle ear, where it can diffuse across the round window membrane to reach the inner ear. While still under investigation, PRP shows real promise as a safer, potentially more effective treatment option in cases of sudden sensorineural hearing loss, especially when steroids may fail or be contraindicated. Platelet-rich plasma is now being evaluated as a promising adjunct in tonsillectomy for improving postoperative outcomes. So here in this video we can see the PRP being applied directly on the tonsillar fossa after removal, helping create a biologically active scaffold that promotes healing. Patients who received PRP reportedly had lower postoperative pain. Their mean visual analog score, that is VAS score, in the PRP group was less than 3 compared to over 6 in the non-PRP group. This also translated into reduced analgesic needs. Those in the PRP group required fewer additional dosages of pain medications. Now in the third graph, notably, no postoperative bleeding occurred in PRP group, while 2 other cases were reported in the non-PRP group. These findings suggest that PRP can accelerate mucosal healing, reduce complications, and improve comfort during recovery, making it a valuable tool in routine tonsillectomy care. Platelet-rich plasma therapy is emerging as a novel approach in the management of atrophic rhinitis also, which is a chronic nasal condition marked by crusting, foul odor, and mucosal atrophy. PRP promotes tissue regeneration, enhances nitric oxide metabolism, and reduces oxidative stress, key factors in restoring damaged nasal mucosa. Clinically, PRP has shown to relieve nasal obstruction, improve overall symptom scores, and even enhance endoscopic findings by rejuvenating the mucosa. PRP can be delivered in 3 ways: as injection therapy into the inferior terminates or nasal mucosa, through topical application during endoscopy, or as a part of a combination therapy with agents like saline or antioxidants. Altogether, PRP offers a regenerative and minimally invasive option for patients with difficult to treat atrophic rhinitis. Let's now quickly sum up the key takeaways on the expanding role of platelet-rich plasma in ENT. Firstly, what is PRP? Platelet-rich plasma is a concentrate of the patient's own platelets, reaching growth factors that enhance healing and regeneration. You know those growth factors at this moment, right? How is the PRP prepared then? It's obtained by centrifuging the blood to separate platelets and plasma, creating a bioactive concentrate ready for use. In post-surgical wound healing, PRP enhances tissue repair, reduces inflammation, speeds up epithelialization, and lowers infection risk. In Tympanoplasty, PRP improves graft uptake and hearing outcomes, supporting more stable middle ear reconstruction. In sudden sensorineural hearing loss, studies show PRP leads to greater hearing recovery than steroids, possibly by promoting cellular repair in the cochlea. In tonsillectomy, patients receiving PRP had less pain, needed fewer analgesics, and had no postoperative bleeding. Lastly, in atrophic rhinitis, it promotes tissue regeneration, reduces oxidative stress, improves nitric oxide metabolism, and improves both symptoms as well as endoscopic findings. In summary, PRP is a safe, autologous and versatile regenerative adjunct in ENT care, showing promise in both surgical and medical applications. Thank you for watching. If you found this helpful, please like, share and subscribe for more evidence-based ENT insights. Thank you.